Hello everyone, welcome to a small session of case-based learning of vestibular apparatus. Here is the case. A 53-year-old man presented to his primary care physician with complaints of feeling like the room is spinning, dizziness, decreased hearing, ringing in the ears and fullness in both ears. He states that the symptoms have been occurring episodically but increasing in frequency. The ringing in his ear was not present initially but has become more prominent. He denies any recent ear infection or trauma. He is not taking any medications. On examination, he is noted to have low frequency hearing loss. The remainder of the examination is normal. After a complete workup is done, the patient is diagnosed with Meniere's disease. So, what are the questions for this case? This case is a basic case of having dizziness and spinning like vertigo like symptoms, and he is having a hearing loss also. So because of these symptoms, after examination he has been diagnosed with Meniere's disease. The first question here is, what part of vestibular system detects the angular acceleration and rotation? That means when he is feeling dizzy or angular motion he is feeling, we have to understand what part of vestibular apparatus detects the angular acceleration and rotation. The second question here is, what is the effect on the hair cell if the stereocilia are bent away from the kinocilium? First question, what part of the vestibular system detects the angular acceleration and rotation? There are two functional units as we have studied yesterday. The first is the utricle and saccule, and the second is semicircular canal. In case of utricle and saccule, they are responsible for detection of linear acceleration, whereas the angular acceleration and rotation is detected by the semicircular canals. So the answer to this question is semicircular canals. As you can see, the angular rotation, the head rotation to the right, the head rotation to the left will be detected by the cresta ampullaris, which is present in the semicircular canal. The second question here is, what is the effect on the hair cell if the stereocilia are bent away from the kinocilium? So as you know, the largest the largest cilia which is present in the hair cell is called as kinocilium, and then there are, in increasing order, there will be smaller to larger hair cells. When the stereocilia bends towards the kinocilium, results in depolarization, whereas when the stereocilia bends away from the kinocilium, leads in the hyperpolarization. Remember, there is a tonic discharge at the resting state. Whenever the stereocilia bends towards the kinocilium, the tonic discharge, the frequency increases. Because of depolarization, increase in the frequency of discharge occurs. Whenever the stereocilia bends away from the kinocilium, the frequency of discharge decreases because of hyperpolarization. So in this case, if the stereocilia bends away from the kinocilium because of hyperpolarization, the tonic discharge will decrease. So that is the output. Here are certain MCQ questions for you. Pause this, look at the options and find out the answers, and you can tell us in the comment section. Thank you.